Hello, my dear students. I'm Dr. Vaishali Bharambe. I've been teaching anatomy for the last 25 years and I love it. What are we going to learn today? Okay, so we're going to learn about the carotid sheath. Now you can see a whole lot of words written here. Okay, and I'm going to tell you that I'm going to cover carotid sheath under the following headings. It's not very inspiring. What is inspiring is another diagram which will teach you most of what is expected to be known about carotid sheath. You will just need a couple of sentences to complete your knowledge. Alright, so let's begin the diagram. Come on students, get your color pencils and drawing books back. I hope you're ready now students. Let's begin by drawing first the internal carotid artery. Remember, all your drawing must be neat and tidy with you telling yourself what you're doing. Don't just draw because I'm drawing. Draw with understanding. Okay, so here first I'm drawing the internal carotid artery. See how thick-walled it is because it's an artery. Take it down. Okay. At one point you can see the external carotid passing away, out. Okay, draw that. With a slight dilatation now draw your common carotid. If you're smart, you would also color this off then and there so that you have the pleasure of drawing, okay? Right, now take a blue colored pen, okay? And begin to draw the internal jugular vein. Remember, this is internal jugular vein. It's a vein, so it will be thin-walled. So draw it so that the lumen is not exactly round, okay? Draw it down up till here, ensuring that your diagrams reflect the fact that it's not a thick-walled structure. Now in between the two, take your yellow pencil and draw the beautiful vagus nerve. Okay, so you've got carotids on one side, jugular vein on the other, and in the center the vagus. Now pick up I would prefer if you picked up a green colored pencil, and now draw the topic which we are discussing, the carotid sheath. Enjoy yourself students. Enjoy the process that you're getting a little break from endless studies. Draw it with enjoyment. As you're drawing the carotid sheath, you find that you have to take a little pause to allow the exit of external carotid artery. Take it further down on both the sides and complete your drawing of the carotid sheath in a way that it at least appears plausible. Don't draw bad diagrams. It's not pleasant. It doesn't build a good image in your brain. We are going to now label these, okay? So here, label below the common carotid artery, here exiting from carotid sheath, the external carotid artery, going left over, passing upwards, internal carotid artery. Here's your internal jugular vein, the vagus nerve. Let's now take a section of this and draw another diagram of the section, okay? Ensure that whatever you draw is thick-walled on the medial side. Why is it thick-walled? I'll tell you why later. Just draw it. Wherever it is thick-walled on the medial side, ensure you draw a nice thick-walled carotid artery. Medial to that, you draw your, again, somewhat not exactly round, your internal jugular vein. Okay? And in between them, posteriorly, draw your vagus nerve. Okay, with this diagram in place, let's come back to the screen and you will be surprised at how easily you understand the topic of carotid sheath. Okay, so you've got this now. Let's come back to the screen and continue our discussion on carotid sheath. Okay, right. So the topic we're discussing is carotid sheath. First thing I've always told my students is introduce the topic to yourself. What is this I'm trying to learn? Don't just read just because you have some godforsaken timeline in which you have to finish studies. There's no point in this kind of studies. Think about it. I'm talking about carotid sheath. How would I define it? It's a condensation of connective tissue. Yes. Around the great blood vessels, nothing can be greater than internal jugular and common carotid, isn't it? Okay. In the form of a tubular sheath called as carotid sheath. Does that make sense to you? So, it's a condensation of connective tissue around the great vessels in the form of a tubular sheath called as carotid sheath. I think for me, this definition definitely works. See if it works for you. Right. So how is it formed and what are its attachments? It's formed, I think now, I'm not going to tell you. Do you remember how it's formed? Anteriorly by whom? Posteriorly by whom? Anteriorly by pretracheal fascia. Posteriorly by prevertebral fascia. You remember we've done all this. So always build on what you know and then take it forward. Don't unnecessarily mug up. You will stop having faith in yourself. We know the anterior layer is formed by pretracheal fascia, posterior layer is formed by prevertebral fascia. Superiorly, it is attached to the base of skull. Inferiorly, it's attached to the adventitia of aorta. Okay, so that covers its attachments. What does it contain? Now, do I have to tell you that? We already know it. It contains in the lower part the common carotid artery, the internal jugular vein, and the vagus nerve. Okay. In a section, you can see how the common carotid artery is medially, the internal jugular vein is laterally, and the vagus nerve is posteriorly. At one point, at the level of lamina of thyroid cartilage, the external carotid artery leaves the carotid sheath. And what is left is the internal carotid artery along with the vagus and internal jugular vein. So now the question is, if external carotid artery pierces the sheath, is there anybody else who pierces the sheath? Let's take a look. Structures piercing the sheath are: 1, external carotid artery; 2, if there is a vein, what should also be there? Tributaries of the vein. So yes, there are tributaries of internal jugular vein and branches of 9th, 10th, 11th, 12th cranial nerves. All these are structures that pierce the sheath. Okay. Let's talk about thickness. You remember we had a little talk on thickness when we were doing the diagrams. As you can see here, it's quite medially thickened. Okay. And laterally, it is somewhat flimsy. It is medially thickened because it's enclosing the common carotid artery. Okay, surrounding it, giving it good support. It's laterally thin because there is always a chance of increased venous return in case of veins. So to allow for the venous expansion in case of increased venous return, you have to have that thin cover on that side. Okay, so that's the reason for the thickness and the thinness. As you can see anteriorly, there are 2 tiny yellow dots. These are the dots indicating presence of ansa cervicalis. And posteriorly, you can see the presence of cervical sympathetic chain. So these are the anterior and posterior relations of the carotid sheath. Finally, we come to the applied anatomy. Here, this I find extremely interesting. I hope you do too. See students, what happens is there is a procedure wherein lymph nodes of your head neck region are removed. Whenever there is a metastasis, it happens in the metastasis spreads out in the lymph nodes in your neck region, so that this may need us to remove these lymph nodes by a procedure called block dissection of the neck. Okay. So when you're removing these lymph nodes, they may become adherent also to the surrounding structures, and this way you'll end up exposing the carotid sheath. Now, I don't have the time, nor this is not the time to discuss block dissection of neck. But in one of my subsequent lectures, there is a little 2-minute discussion on block dissection of the neck, which gives you an idea of why you should know the anatomy of the neck from surgical point of view. So do read upon this. You will find yourself really surprised at the kind of surgeries that take place. See if you like it, do read. Right. So now we complete the topic of carotid sheath, and now let's take a look at these points that are displayed here. Can you define the carotid sheath? Remember I told you how to define it. It's a connective tissue sheath enclosing the great vessels of the neck in the form of a tube called as carotid sheath. Then we talked about how it is formed. Okay, then we talked about its attachments, contents in the lower part common carotid, in the upper part internal jugular, internal carotid artery along with internal jugular vein and vagus nerve. Then we spoke about structures piercing it, anterior relation of ansa cervicalis, posterior relation of the sympathetic chain. We talked about the thickness and applied anatomy of block dissection of the neck. Alright, so with this I end my lecture. I had a great time taking this class with you. I hope you enjoyed it too. See you across the screen in some other lecture. Till then, keep studying. keep drawing, and keep learning. Thank you.